Thank you for the intro, and thanks for the opportunity to be here to share some thoughts and experiences. So Beth is going to help me make sure we get to Q&A, because I want to make sure we have a dialogue. But I'm going to ask you to do a couple of things with me so I can get there. One is we're going to ask you to use your, I think Beth Babcock talked about working memory, right? So I'm going to move at a quick pace. And we're also going to ask you to use, I think it was shifting, do some set shifting. So I'm going to lay out some theories, I'm going to make some leaps, and I'm going to ask you to follow me, right? But I think we can do this together because we have the executive functioning that we need as adults. But I want to start then in the theory of neighborhood change, right? And couch the Dudley Street Neighborhood Initiative's work in this larger effort that you can kind of tag back to the war on poverty. So anti-poverty community change efforts that have come up through the decades that advanced from the siloed categorical approaches of just housing and just jobs, move to a more comprehensive, complex look of how we integrate these things. And then today is pushing us to really look at how we align and leverage. And I want to talk about that in those terms, the work of DS&I. But a little bit, I recognize that I'm leaving out of my presentation a lot of other topics. And I want to sort of lift them just so I can leave them behind and begin to focus. But in the comprehensive work of transforming communities, there's a lot to think about. The framing of bridging people and place building, socioeconomic and physical development is really important. And then the notion that the neighborhood as a unit of change is really, really important as I make this presentation. So with this slide, I'm going to tell you what I'm going to tell you, then tell you it. But after I tell you what I'm going to tell you, you can zone out, right? And go get more coffee. So we've heard a lot about the importance of the early years. We've heard a lot about the importance of family and strong, healthy families to support the early years. I am now going to talk about the importance of systems supporting individuals and not being the barriers to families supporting their children, right? So one way to look at it in a very important way are the individual responsibilities that we all have, right? And so let's teach our families. Let's give our families information and instruction. And that's a very important lens to this, right? And you'll hear about the work we're doing there. But the other half of the story is not just to blame the families, right? But it's to begin to think about the non-supportive systems or even the barriers that might exist and even the supportive systems that we can actually strengthen or accent that would continue to help families. Because we all know that we can't continue to pour money, and I think Dr. Yogman said it, into the 20% as if we're going to program them to death and move them somewhere else. That in fact, we have to also think about the systems that we've created and what might be the new systems that need to be created to help families act in a different way. So I've now said what I'm going to say, right? And you can hear about the story of how we're going to do it, because I think the way that we're approaching designing systems or redesigning systems and thinking about systems differently is through the neighborhood lens. Right, that we think the neighborhood is a manageable way to think about how systems or places interact with individuals. We're also choosing to do this by not approaching all systems. We think that the right system intervention is through the education lens. That if we could, looking at education at all levels as a system of real importance intervention, that is really hinging on other systems working. Education is hinging on our housing system working. We know mobility is really important. on health care working. We know children can't learn if they're not healthy and not in school, et cetera. On jobs. So you can begin to think about this system as an entry point to have a conversation. Then we've bought into this Promised Neighborhoods look of how we might be able to take medium need and high need families through a very supportive system with education at the center to yield positive outcomes for children and families, right? With the other systems as critical to the success of the education system. I understand I'm asking you to do a lot of set shifting here, but we could do it. And then the only way that we can really have an impact as a neighborhood on any kind of system is by not one organization going at it and our, small little budget, but it really is about leveraging all of the other activities and systems and grants and programs that happen to be working in our neighborhood. And to the extent that we could coordinate, that we can create collaborations and partnerships and have similar goals, similar metrics, similar reporting, then we might be able to make a dent and think about systems reform in a very, very important way. So leveraging resources, integrating and targeting as a collective is very important how we do this work. And the other theory of change I want to layer in here before I start talking about some specifics is this notion that resident leadership and engagement, in order to align structural and physical change to systems strengthening and integration towards common outcomes, is the important demand factor. That the way to do this is that families and communities are demanding quality, demanding better outcomes, and that we are important at the table as partners who are ready to then make it work. Not just saying we've got to do this better, not just being informed advocates, but saying we have to do it, we can't accept anything less, and we will be here to help get there. This work is not 2 years' work. It's not 3 years' work. It's not 4 years' work. It's not 5 years' work. And in fact, when my board made the decision in 2009, after 25 years of work, that the way we would know if we had any kind of population-level change in the next 25 years of work in that neighborhood was to say we would have to follow the outcomes of children as being the most dependent part of the ecology of the neighborhood. It took us since 2009, 2013, to begin to even create the beginnings of the infrastructure to put those kind of partnerships in place and measure the kind of system that would put children at the center, families at the next level of concentric circle, organizations and businesses, community institutions, and systems, right? And so we're only beginning through the work we're doing with the Promised Neighborhoods planning process and grant to lay out the kind of capacity as a community that would allow us to create a seamless continuum of supports and systems that are coordinated and grants that are leveraged and metrics that are mutually agreeable to support residents from age 0 to 24, cradle to career, and articulate a vision that could become the vision of the neighborhood where neighbors can talk about the Dudley neighborhood being a village campus, where we integrate social efficacy with personal agency through learning and development. There are all types of things we're then thinking about what it means to create a neighborhood that's a 21st century campus. There are themes that we need to pay attention to, from basic needs, housing critical, health critical, jobs critical. I don't need to tie back to what some of the other presenters said before me, but they made that clear. Dr. Shonkoff made that clear. What we know Crittenton is doing is very clear, and the reasons why are very clear. Quality school pathways, caring, consistent adults, positive peer groups, access to a wider world. These are all things that we understand, given the research and everything else, that neighborhoods need to be designed around. We also understand that this needs to be done from a cradle-to-career standpoint. And in doing that we need tons of partners that are going to be working with us to create a supportive neighborhood from birth to school entry, kindergarten to high school to college and career, and then to be active citizens in the global community. All of which is nonlinear and dependent on each other to be successful. And I'll talk about that as how we are going to measure success. Breaking down agency silos. We can no longer afford people working in their own corners on these different things, but we have to bring partners together to leverage the kind of resources and intellectual capital and political capital that we need to do this. Now, this all brings me to Dudley Children Thrive, which is an example of an initiative and a campaign in our neighborhood that we're working with a lot of partners, including the United Way, including the City of Boston, Boston Children Thrive, and a number of other folks in this room, including the Boston Children Museum, and I can go on and on as I look at faces in the crowd, to make something like this a place-based, systemic effort to support family and children. And, Dudley Children Thrive, in fact, we all know it's part of a citywide initiative, but it is what we have decided is the core place of entry to the whole continuum. That as a neighborhood, from a management standpoint, we decided not to take the whole continuum and start it all at once, but we decided to focus, for a lot of reasons that you can imagine, given the previous presentations, on 0 to 5. And starting in 0 to 5 allows us to, in fact, start with families. Right? So to date, we've enrolled, there are 436 families that would say that they're part of the DCT, or Dudley Children Thrive. Of that, 669 children under the age of 5 years old. That would make up 722 adult members. Large percentage are mothers, but there is a very large group of concerned fathers that are emerging in a real leadership way to be a charge for this in the neighborhood. Grandparents, uncles, extended families. I mean, you guys understand the family situation and understand all of the supportive adults that you need to continue to push your families. There's tons of facts on these families, and we're not going to go over them all, but it's important to know that, in fact, I think, one fact that's not in here is that when families are asked how we can help them most, they say training, and particularly job training. So in turn, how can we help the child most? And this goes back to what Dr. Shankov said, which I think is spot on, which is to help the adults be able to support the child, right? And this is, in fact, what we are going to focus next, but we continue in a major way, and I'm going to talk about that, but that we focus on as part of Dudley Children Thrive, parent empowerment, family support through community partnerships. When we talk about parent empowerment, and you guys know this, and so I'm going to quickly blow by it. Parents as the first teachers, as advocates, as community builders, and as leaders. And it's a mind shift from the deficit model. As parents, as those who don't know what to do with their child, don't have the executive functioning skills, or any of the things we typically talk about providing families. Information sharing is critical. Now, because I've been given the 5-minute mark, I'm going to quickly blow through this so I can get to the part I want to get to, because I do want to get to Q&A. Providing opportunities for families to understand not only what they need to do, but to do it, right? And one example quickly is the Word Build campaign. The tagline, we build their world when we build their words, has been an amazing energy grabbing and movement in the neighborhood for families through the work that we've been doing, that our organizers have been doing. And I've got Aisha Rodriguez here, and if I don't mention her and act like I'm doing this work, I'd be remiss, right? So I just get to become executive director and talk about this work. But there are some important people who are making sure that these connections are happening and making sure that families are supportive in very creative ways. I am going to blow by this. I apologize. But I think the PowerPoint will be available. Is that right? Right? So I can say that publicly, and you can go back and look at that, and we can have different dialogue. But The next thing we decided to do after starting creating the infrastructure to plug in families and build our own capacity and understanding as a community, how we wanted to engage partners in this work, et cetera, is to begin to set the underlying question that in 25 years we can answer, did we have population level change in our neighborhood? Were we able to, in fact, have different child outcomes? Were our children ready for school? Were our children ready not only with academic skills and work through word build, but through executive function, et cetera? And so we are laying it out, and actually, I see one of my board members here, Pam Ogletree from Children's Services of Roxbury. In front of the board, we will be laying out this question this Wednesday that will set up our next 25 years. What will it take for a tipping point number of poor and low-income families in the targeted geography to get and sustain themselves on an irreversible path to greater economic prosperity and or thinking about it as the middle class? And we probably won't end up using that term, but because it's loaded. But if you could begin to think about sort of a movement that's not programmatic, but that's sustainable, right? A lot of folks have tried this, and there's been a lot of disappointment, and there's still people point to us pouring money into this and not having success. But we know through the work of Crittenton and others that there's some really good efforts going on. But we also know that we can't service people out of poverty through short-term, single-dimension, low-dosage programs, right? Because we could only be able to serve the people that we can touch. We know the families that are going through the Crittenton model are going to have better outcomes. I have no doubts. But can we set up a neighborhood or a place where all families, all children have better outcomes, right? And so what we want to do is have a multi-generational effort to take, at the very minimum right now, we're working with 500 families through our continuum, and in doing that, make systemic changes so that we do not provide money to bridge them through the cliff effect, but that the system is reformed to understand what families need to get to economic sustainability. I've asked you to do a number of set shifts, borrowed some theories that I've moved and applied in other places, and I'm going to stop here. And these are the partners that are working with us on this new venture of tracking at least 500 families. And we think if we're going to track 500 families for high dosage, the number's more like 2,000 families. And we're really excited about that work because we really do believe, and what Dr. Shonkoff said, that in order to have our children be supported and developed in the way that they should, we will need strong families and strong communities. Thank you.